I want to share with you a few tips for breastfeeding. So, I'm not a breastfeeding consultant, but I do work with clients helping them get pregnant. And then once they are pregnant, I help them throughout the pregnancy. And before the birth, I always like to meet and to explain about breastfeeding and about, just to prepare for the birth itself. So, these are tips that I found for myself very helpful and for my clients. So first, babies eat every 2 hours, day and night. And I know in the books it says every 3 hours, but that's actually not as accurate. The 3 hour is more about babies that eat baby formula, but for babies who breastfeed, it's usually around 2 hours, even every 1.5 hours. So how do you even start counting when does the feed start and when does it end? So let's say you started feeding at 12 noon and you fed the first boob for like 20 minutes and then you burped and then you changed the diaper and then you offered the second boob and that was like 40 minutes and by now it's 12:40. So the feed started at 12, meaning the next feed would start at 2. No matter when you finished, you count the feed from when it started, meaning that you only had about an hour and 20 minutes to yourself before the new feed. So it's a very rigorous process. And this happens day and night. So it's like it goes in cycles. So there's a cycle of feed, which takes with newborns about 40 minutes, 45 minutes. It could even be an hour. Then you have just a little bit of time to pee. And then it happens again. So that happens day and night. They do get more efficient, so it's not going to be like this for months. Only for let's say the first couple of weeks, it would be, a lot of time on the breasts. But as they get older, and also as your breast produces more milk, they become more efficient. So, hang in there. It's gonna pass, even though I know that these few weeks seem like an eternity. It's gonna pass. So that's my first tip for you, just to know how to count the feedings. Because you're so tired and it's so challenging to remember when the baby last ate, I would really recommend to write it down. So always write down, for example, 12 noon, left boob, changed diaper, burped, second boob, 2 o'clock, right boob, and so on. You always want to change your breasts when you breastfeed, because if you use this one the most, then you want to give it time to fill up with milk again. So the next feed you want to use this one. So you always alternate between the breasts. So because it's so challenging to remember which breast was last, besides writing it down, I also recommend to just use, a hairband, and then each time signal which one was the last that you finished with, so you can always alternate. So my next tip for you is about feeding positions. I'm going to use my kids' dolls for it, because that's all I have now. The best feeding position, in my opinion, is the football position, it's called, where you have your baby sit like this, and you offer the breast to the baby. And this position is technically recommended for women with large breasts, but I found that it's actually the best for all women. Even women with small breasts could really benefit from it, and I'll explain why in a minute. But this is just a position, so you just have your baby be on your hand, and it's better to have a pillow underneath, and then you just hold him like a football and you offer the breast. The reason that I feel that this is the most effective breastfeeding position is because it's not just about offering the breast, it's about the baby latching. So the babies have an instinct to latch. It's not that the breast is just in their mouth, they also need to work. They need to actively suckle. And they start suckling because they have a reflex which happens when the breast touches a specific point in their mouth, and it makes them start doing this movement, which makes them want to suckle. So when the nipple enters the baby's mouth and it touches the upper palate here, it causes the baby to start latching. So you always want to think to have the nipple touch this. And then when it touches this, the baby starts making this. And the good thing about the football position is that because the nipple is straight, it touches that point, that upper palate point, exactly straight, and it makes the baby start suckling. So it teaches the baby how to suckle, it teaches you how it feels like when the baby starts suckling, and it overall gives you confidence that you are able to breastfeed and that the baby is breastfeeding well. So I would really recommend to use this position for the first few times and just practice on how it feels like when the baby suckles, and how does the baby find that specific point in its mouth for it to start suckling. This really helps to just raise overall confidence in breastfeeding. Between the breasts, you want to pick baby up and to burp the baby. Then before the next breast, you changed baby's diaper. Maybe you want to burp again, and you offer the second breast. This is what we always like to call dessert. If the baby wants dessert, it's fine. If they don't want dessert, that's also fine. The next tip I want to share with you is how to help the breast produce more milk. So in movies, we always see the mom nursing like this, and it's always something so peaceful and nice, but actually it needs to be way more active than that. So you need to always squeeze the breast and massage the breast to allow more milk to come out. And also, because babies tend to fall asleep while they breastfeed, you want to always kind of, massage them and squeeze them a little bit and wake them up. So it's actually a very active thing that you're doing. You're massaging the breast, and you're massaging the baby, and you help baby not to fall asleep, and you burp the baby, and then you do the second breast. So it's not really this serene process. It is very nice and it's very fulfilling, but you just need to know that it's something very active, that you're always working on the breasts and helping baby not to fall asleep for as long as you can, because at some point they'll just fall asleep and that will be it, and then you know that the feeding was over until the next feed. But if the baby woke up after 5-10 minutes, you know that actually maybe I should next time help baby try not to fall asleep as much as I can so that the feed would last longer. That's why you also want to change a diaper. It helps baby to wake up for a second and go back to eating. And then the feedings can become more in pattern of, as we said, every 2 hours, every hour and a half. And the last tip I want to share with you is to wake babies up. So babies, newborns, sleep all the time, and sometimes, especially for babies that were born either premature or that they had a lower birth weight, they tend not to wake up. So you definitely want to wake them up. If they don't wake up, you can change the diaper or you can change their clothes, and it helps them wake up, and then you offer the breast. So even if the baby doesn't show signs of hunger, meaning it's not crying, you want to wake the baby up. And this is a key tip that I think is very, very important for women to understand, because with a lot of my clients, when I tell them that, their first reaction is, but why do I need to wake them up? They have instincts. They know when they're hungry. So newborns don't know when they're hungry yet. Many of them don't. And it's very hard for the mom to realize that and to understand that, no, I have to wake baby up. So don't have 3 hours pass before you gave feeding again. And then a lot of my clients tell me, so what did they do in Africa? So my answer is always, I don't want to scare you, but not all babies survived in Africa. And we do have all these tips to help babies thrive as much as they can. So don't allow more than 3 hours to pass before you wake baby up to feed again. So you always have an alarm clock. From the last feed, you count 3 hours, and then you have an alarm clock. And if the baby woke up before, that's great. And then you set the alarm again, but never have 3 hours pass. Once they reach 3.5 kilos or 7.5 pounds, then you know you can stop waking baby up to feed, but that will take a couple of weeks maybe. So yeah, these are the tips that I can offer for breastfeeding. If you have any more questions, you can ask in the comments below and I'll try to answer, or my followers can answer from their experience. Thank you for listening. See you next time.